I would like to take this opportunity to welcome everyone. Thanks for joining this virtual meeting. My name is Grace Alupo, the country director for the Water Trust here in Uganda. And it's quite exciting to come this far, where we have some lessons to share. With us, we have our presenter is going to be Chris Protas, our executive director, who is based in New York and who has also been closely working on this project and coordinating with our research universities in the US, as well as the teams and the stakeholders that we've been working with here in Uganda, the government of Uganda, the civil society, the district local governments, and all the communities that have benefited from this. And I must say that I would really like to appreciate USAID for this opportunity, for providing the financial support that enabled us to conduct this research and pick lessons that I believe most of the stakeholders that are participating will be able to take forward as we forge the development of Uganda as a country. So apart from Chris, we will be joined also by a technical expert from the Ministry of Agriculture, someone in charge of livestock and poultry. So at the end of this meeting, in case we have some technical things, he will be able to share with us and also give some insights of what happens around that area in the country nationally. You'll also appreciate that Uganda as a country politically supports really the work around livestock and poultry. It's a priority because this is well elaborated within our policy, within the legislation, within the strategies of the government of Uganda. In terms of the frameworks, implementation frameworks, it's very clear. The responsibilities at different levels are outlined. So that is really encouraging. And in terms of economics, you realize that according to the reports of the government of Uganda, poultry contributes to the gross domestic product of the country, but also there are quite a number of health benefits that we gain from this. And socially, I'm proud to say that in Uganda, there are some social cultural values that are attached to poultry. So it is something that is like high value to really have in a homestead or in a community. There are a lot of social values that are attached to poultry. And in terms of environment, we've seen like poultry droppings being used as part of manure to really, improve the soil nutrient and value, which really improves on agriculture as a whole. So really, there are quite a lot of things that we can say about this. And I just wanted to say that today's agenda is mainly the introduction that we are doing now. And just to conclude on the introduction, I would like to say that there are quite a number of stakeholders that have been invited for this virtual meeting. We have stakeholders from the Ministry of Health, we have the Ministry of Water and Environment, we have the Ministry of Local Government, we have UNICEF, we have UNHCR, we also have World Food Program, UN, WHO, we have WaterAid, and civil society organizations like IRC, Water for People. We have institutions like Makerere University here in Uganda. We have umbrella organizations like USNet. We have the leader of government business, Office of the Prime Minister, that closely works with the Water Trust, especially in our work around the refugee settlements. And then we have district officials, we have USAID, we have the World Bank. All these are stakeholders that have been invited. And so I believe we shall have learning cutting across and also picking lessons from the different stakeholders. So that is that about the introduction. And then still on the agenda, we will have the poultry training project in the rural Uganda, presentation of the lessons that have been learned. And then we shall conclude with a question and answer session where we have some experts that will be joining us or have already joined us, so that people are free to ask what they feel they need to understand more around this subject. So I thank you once again for joining this, and I wish all of us good deliberations as we move forward. And I guess now, Chris,
Great.
I'll send the ball back to you so that we can proceed. Thank you very much.
Great, thanks, Grace. I appreciate that. And I'll just point out, you know, as you can see, I believe Scovia Namande and Simon Mugume, who are senior community development officers, so they're here as our subject matter experts, because they've been the ones in the communities working with our teams to try and change people's behaviors around poultry management. We also have our research partners, Aisha Ertruman and Angela Harris from North Carolina State University, who are on hand as well for sort of the more research side of questions. And we know these Q&As can go in different directions. I mean, our primary goal here is to really bring together stakeholders in Uganda. We know that we have a global audience, and we have a mix of researchers as well as practitioners and government officials. So we'll do our best to try and to get to everyone's questions, but we're gonna focus more on what's sort of most applicable in the Uganda context for today. Just a little bit of background about the Water Trust. We've been around since 2008. We've been working in the same part of Western Uganda that entire time. I would say what sort of makes us a little bit different than maybe other WASH NGOs is that, yes, we do technical work. We do rehabilitations of simple water systems, construction of simple water systems, and we do technical work in schools and things like that. But we really focus on behavior change programming on the social side. And I think a core part of that, which is relevant to this, is our use of savings groups. So we started forming savings groups in late 2016, early 2017 to improve the sustainability of the water points. So they would maintain a reserve fund for these remote rural water points. And then in time, we came to see them as a platform also for hygiene and sanitation promotion. And so in this project that we'll speak to, we're sort of targeting these groups. So we've trained around 600 of these groups so far, actually more than that now. And they're kind of a core part of what we do, which is related to this, but also distinct. In terms of WASHPaLS, so what is WASHPaLS? So WASHPaLS is the initiative that's funded our work. It's a grant that's awarded by the United States Agency for International Development, and WASHPaLS stands for Water Sanitation Hygiene Partnership and Learning for Sustainability. We have a lot of great fellow grantees, some of whom are here doing interesting work around animal rearing, as well as I'm seeing here, hopefully folks can hear me. I'm gonna do my best to adjust that in a second. All right, well, in a moment when I pause here, I'll try and up my microphone, but hopefully you can hear me okay. WASHPaLS is a project with, it's a 5-year initiative. I'm not gonna go into the details of it. You can see some of the information here around the small grants program that we're a part of. This is also a good moment just to say that this webinar is made possible by the support of the American people through the United States Agency for International Development, and the contents of this webinar are the sole responsibility of the Water Trust and do not necessarily reflect the views of USAID or the United States government. So with that said, we're gonna kind of move on now to the actual project. And I'm gonna skip a video because we're a little bit behind on time, but I will share this link in the chat so that folks can watch this. It's a very brief video that really gives you a good sense of what it looks like, what our program looks like. So we'll send that now. And we have other videos as well that are longer on our project. So if folks want to watch that afterwards, you're welcome to. But let's focus on the topic at hand here. So opportunities with improved poultry management. So like what motivated this work and what motivates a lot of the stakeholders. And it sort of depends on what sector you're coming from. So from the WASH sector, again, it's about reduced fecal exposure for young children, in particular poultry that are sort of free roaming around during the day and at night, leaving feces in the dirt that then gets mouthed by children or ingested by children. If you're in the nutrition sector, you're looking at the protein availability of chickens, which is the most common livestock animal in Uganda. That's through the chicken meat, but also the eggs. If you're interested in livelihoods, you're thinking about this from the perspective of how can we make these more productive. Chickens are temperamental livestock animal in the sense that they're highly seasonal. There's a lot of seasonality in terms of their productivity. There's kind of rampant death through disease and predation. And so there's lots of interesting ways that you might think about making these chickens more productive as other organizations have tried to do as well as we did. Also looking at gender, in theory, if you improve poultry management and improve productivity of poultry, you increase the asset base controlled by women. So from a gender perspective, poultry are interesting. And then finally, from a resilience perspective, poultry are not just a livestock asset, they're also a form of savings in kind. So it's a way to save and have an asset that you can, sell for school fees or things like that. So if you can increase the productivity of poultry, you're also increasing the resilience of these families beyond those ways above. All right, so what were our research objectives? Number one, can we improve poultry management practices? And if we do improve those poultry management practices, does that translate into reduced fecal contamination? And if we do that, do these improvements translate into reduced diarrhea for children under 5? And then with that, of course, we want to understand the mechanisms. And that's a lot of what we're going to talk about today are the mechanisms. How we did that is through a randomized controlled trial across 100 communities and microbial, and actually this is out of date, sorry, microbial hand rinse sampling across 100 treatment and 100 control households. So that was hand rinses of children that were done by their parents. Their caregivers, is what we ended up doing due to some adjustments we had to make with COVID. All right. So in terms of our intervention, what did we actually try to do? So concretely, our intervention included triggering, as in awareness raising, similar to community-led total sanitation, but focused on poultry feces and trying to increase the salience of the risk of chicken feces to children, as well as the wasted livelihood opportunities of current practices. So it was both trying to raise awareness of the health risks as well as the livelihood risks of current practices. That was followed by a 3-day training that was really practical hands-on learning. You can see here one of our community development officers out in a community pre-COVID, training people on how you cage and corral poultry and things like that. Following that, these monthly coaching visits, the idea was that when you do the training and the triggering, that's not going to be adequate. So you need follow-on support where, you have a staff member in the community asking people what obstacles they're facing, troubleshooting with them, getting them to kind of pledge to make changes, and then following up to see if those changes were made on a monthly basis. And then finally, chicken loans. So these were something we added, wasn't initially planned. And this is a good moment to talk about sort of the impact of COVID on our programming, where essentially we conducted triggering and training and then COVID occurred right then. And so our coaching visits really didn't happen. There was essentially like a 3-month gap between the training and the coaching. And at the same time, the other impact COVID had was that the savings groups that I mentioned before, they typically start around January, their cycle, which means they kind of cash out everything and then they restart saving. And so what that meant is with COVID is that these groups were very undercapitalized. They had very limited savings at that time. Obviously also group meetings were interrupted and suspended for a number of months. So the groups that we had envisioned being a kind of core part of the network here in terms of providing social capital as well as financial capital weren't really present during this time. So we tried to see if an infusion of cash, which happened very late in the program, would be adequate. Now on a per person basis, these group loans are very small. But the idea was that maybe that would provide a little bit more liquidity that would allow people to make investments. All right. So now, like, what's the context that we're doing this intervention in? I think it's important to kind of set that scene because it's relevant for what challenges we had in this project. So again, just in terms of housing quality, because before people think about housing their poultry, they think about housing themselves. So you can see that housing quality, which is also an indicator of poverty, these are not metal roofs. These are not sort of finished houses for the most part. And you can see around hygiene, pretty limited at baseline here. And sanitation, you can see actually is pretty strong. These are communities where we have done hygiene and sanitation promotion before. And so you can see, frankly, also where we have had success on the sanitation side and what we found much more challenging around hand washing with soap. And you can also see sort of what the poultry practices are that we find here. And I would just note that this is one sort of learning we have on the measurement side, is that this is highly variable from like season to season, month to month, in terms of number of poultry you'll see roaming, in terms of number of poultry that are alive, and number of poultry feces that's observable. But I think what's important here is the difference in amount of poultry feces you see versus human feces. You can see that it's quite different. All right. Okay, so I think the big question right off is sort of, did this program work? We have this kind of context, we have these this kind of intervention, and there really isn't much evidence on the sort of what impact training only interventions can have. There's another project that has an acronym SELEVER in Burkina Faso that occurred contemporaneously with ours. And I'll get to some of their findings, but aside from that, there's very limited information on this. And what we found is that no, this was not adequate to really change the intermediate outcomes of interest. And we have some of those listed here. So free-ranging poultry, chicken feces, poultry enclosure presence, self-reported indicators of corralling chickens at day or night. And so the question becomes, okay, why? What's going on here? And we don't know for sure, but we have some ideas. Capital constraints, again, that's related to COVID, but I think it would be unwise to just assume it's all because of COVID. I think that it probably was related, but based on what we see in Burkina Faso as well, and what some interesting formative research that has found in Bangladesh, which I'll talk about later, I think that we can assume that that's a real constraint, not just COVID. Another potential reason would be that while we change risk perception from, we believe we change risk perception, it's not adequate enough to change behaviors. You would have to have a more effective way to increase risk perception. I think another issue is around the relatively low ROI of poultry management investments. And by that, I mean, even if you gave them capital, gave a community member capital, they might think it's more productive to invest in agriculture, for example, improving land, renting land, buying land. So you're not just saying this is a way you can make money, but is this the best way for them to deploy capital? And I think conversations with some livelihood organizations suggest that the answer may be no. Like if you give households capital and they have discretion about how they're going to do it, they may not be choosing to deploy it to improve their poultry management. They might choose an alternative, which is really relevant for us if you want to improve poultry management. Another issue, which we'll talk more about later here, is even when people have an enclosure, they still let poultry roam free. Now, if you have an enclosure, you're more likely, there's a statistical significant difference. You're more likely to have poultry confined, but you are still letting the majority of your chickens roam free during the day. And I think that's an important kind of practice to note, that you can't just assume if you have an enclosure, you've solved the problem. And then another issue that our team has raised is that we're in a corridor where there's a lot of internally displaced people and migrants. And so there are people who do not want to invest in improving their land necessarily because they don't know how long they'll be there. And that's sort of worth noting as well. All right. So in terms of unpacking this, the enclosures and the free range chickens, because I think this is an important kind of topic that's come up and something we've talked about with our research partners and some of the other organizations and researchers that are looking at this in other contexts, is trying to understand this relationship. So in our context, around 42% have some type of enclosure. You can see here, this is sort of like a model enclosure that we're promoting in this image. They don't look like this. They all look different. And so what an enclosure is itself is tricky. And what you can see here is, as I said, that if you have an enclosure, you're more likely to corral, at least according to what you say. But you can see that it's pretty similar. So at night, whether you have a sort of dedicated enclosure, it's pretty similar. So you might be using a separate room, even if you don't have an enclosure at night. And during the day, they're both really low, right? So even if you have an enclosure, you're up to 14% rather than 3%. And that's self-reported, which is still not very good. So I think from a program design perspective, that's important to keep in mind. And also another thing is that households that had enclosures are more likely to have more chickens and have more free roaming poultry. So you might be creating an issue where you are increasing the incentive to have more poultry because you have this enclosure. And so you're actually increasing the number of poultry that are free roaming and defecating. And finally, as it says there, there's no association that we found in the baseline data of enclosure presence with chicken feces. So I think that those are all important and relevant findings here as we try and unpack what we should be even trying to accomplish and what impact improving enclosing chickens will have. All right, and I apologize for going quickly. I'm just trying to get us to the Q&A as quickly as possible. So if you have any questions, feel free to put it in the chat box and we'll get to it. So I think taking a moment here to kind of reflect on barriers to poultry wash. It's something, you know, a term that I've come to really focus on is this chicken poverty trap, where it may be enough chickens to create feces in the home environment to make children sick, but not enough to warrant investment. And I'll just note that, again, that study in Burkina speculated that the economy of scale needed for chickens may be as high as 100 chickens. So there's a huge question here around like what is actually feasible and what makes sense given the backyard chicken rearing. As I mentioned before, uncertainty about what you get with an enclosure. It's not going to be adequate to just increase the enclosures. That's not going to address the issue of free roaming poultry. And I think another piece here on the third bullet is we did measure risk perceptions. We measured self-efficacy essentially around some of these practices. Like, do you feel like you can do this poultry management practice? And there's no detectable impact on self-efficacy. If anything, it seems like it maybe got slightly worse, maybe, but you know, that's me, not the research talking. And I think the question is why, and it might be because people just, they now know how much work is in poultry management because they've been trained on what it really encompasses. And so now they can see the gap between what they are currently doing and that. And so it actually seems more daunting than before. And then a final sort of note here around measurement. I mean, I think we're still unpacking all the lessons to be learned here, but we do have data from both our baseline as well as 2 end lines that are several months apart so that we could get adequate statistical power for the health outcomes. And what that also gives us data on is how some of these answers change over time. So how does risk perception, how consistent is risk perception from September to December? How consistent is the practice of corralling or self-reported corralling, things like that? And we're gonna have to take more time to say anything conclusive, but I think what is clear is that these relationships are really complicated and they are not predictable. And it's going to take a lot more work to really figure out what these measurements are telling us and what they mean. So as I mentioned, complementary research findings, I just want to highlight a few notes. You know, there's some interesting work, ICDRRB, if I got that right. If not, I apologize. And researchers, I believe at Johns Hopkins and Stanford, have done some interesting work around backyard poultry rearing practices, looking at ducks as well as chickens. And they did some trials of improved practices where essentially they kind of like gave households setups in terms of ways to manage their poultry, and found a lot of barriers as well to daytime corralling. And currently they're piloting an intervention that tries to change nighttime corralling practices, and we'll see what they find. But I think that's notable because it's, again, follows the same pattern of what we're seeing. In Burkina Faso, I think this is really interesting and relevant because you might look at what we've tried and think, okay, well, you just need to do more. You need to do more value chain work. You need to not only tell people to vaccinate their chickens so that they'll keep them confined and they'll be healthy, but you need to actually equip volunteers with immunizations. You need to establish a cold chain for those vaccines. You need to do all this stuff. And this program essentially did that. And what it found was it could increase the number of poultry being produced. It did not increase profits. It also did not have any benefits on self-efficacy. It also did not address the significant inequalities in poultry outcomes between men and women. And as I mentioned, it thinks that, you know, part of this might be an economy of scale issue, but the economy of scale is very far off from the individual household. So I think these are all really relevant findings and something that, as we think about what's next and what might be an alternative, some things that we're keeping in mind. Okay, so, you know, this is the last slide, and then we're going to turn it over to the Q&A. But to me, these are kind of some of the key learning gaps or things that we're thinking about. You know, one, similar to the Bangladesh program, the pilot that I mentioned, is if we focus more on a particular behavior change, so not trying to transform how people manage their poultry as a livelihood, not trying to build a house, not trying to do all these different things, but if we focus on one or two things, is that a way that you can have an impact that is significant and kind of clinically significant as well as statistically significant? And I think that's an interesting stream to explore. Another one is looking at the transformation goal of saying, is there a bundled asset transfer with training that can solve those capital constraints and actually transform chicken rearing into a productive, safe livelihood practice? Obviously, while there's not good evidence for training improving poultry in our project or in the Burkina project, there's a lot of evidence on the impact of what are called graduation programs that bundle training with coaching and asset transfers. I think another question that sort of emerges from this, given the economy of scale issue, is community level chicken rearing. I think it's something we shied away from because it seems unlikely that even if there's a community level chicken rearing association, let's say, it seems unlikely that households will stop having chickens themselves. So you may be essentially creating a chicken business at a group level, but people still have their chickens at home. So you're not, if you're interested in the hygiene aspect, you may not be addressing that at all. But I think that that's an interesting stream as well. And there's obviously other interesting potential directions for this, but I think for us, the Water Trust, these are really relevant learning gaps. Okay, great. So we're almost at about time now. So again, we did want to turn this over for a Q&A. And so Grace, I don't recall if the gentleman from the Ministry of Agriculture was able to sign in successfully.
Yes, I'm on.
Yeah, he's on. Dr. Mugezi is on. Yeah.
Excellent. Well, then, do you mind, Grace, is providing again another introduction, and then we'll turn it over for some initial reflections.
Okay, thank you very much, Chris, for the good presentation and the highlighting key issues. I think that was good, and also the comparison between the different countries, Uganda, Bangladesh, Burkina Faso. I think that was quite interesting. And they are talking about being mindful of the value chain. What does this mean in terms of uptake? What really can cause significant change? Is it focus? Is it looking at the whole, value chain? So I think these are critical questions that the presentation has raised, and I believe there are many more that have come on the chat. I want to take this opportunity to introduce again Dr. Mugezi, who is an expert from one of the leading institutions for this work, the Ministry of Agriculture here in Uganda. Dr. Mugezi, you're most welcome, and I want to invite questions or technical questions that people have, so that he can be able to respond to some of them. And maybe to mention to Doctor that we received the confirmation from different organizations to participate in this meeting, including the Ministry of Health, Ministry of Water, Ministry of Local Government, UNICEF, UNHCR, World Food Program, WHO, civil society, umbrella organizations, academic institutions like Makerere University, the district local governments where we did this research. USAID, the main funder for this, and we already appreciated USAID for providing financial support that enabled this research to go on and for us to be able to pick learning. So, Doctor, I don't know if there's anything you would like to remark, and I just want to welcome you and encourage people to share.
Okay, thank you, Dr. Rupo. I've liked the presentation. Actually, I also did some research in poultry. It was about the economics of poultry production. Although this was basically for the urban setup. But as I've been asking in the group chat, there are some questions we need to ask ourselves. One, what is the driving factor for people to rear poultry as roaming? Okay, I believe one of the reasons is feed availability, because you know that for poultry, we have, for those who are doing intensive poultry rearing, over 70% of the costs, those costs that go to feeding. So I have a feeling that the rural people have the same challenge. Even if you build a shelter for them, when they don't have, I believe that intervention may fail, because why most of them make them roam, it's because they don't have maybe money to purchase feed for them. So they would rather leave them roam freely and scavenge by themselves. And you'd realize that some people even go ahead and they have shelters for this poultry, but these shelters are basically used at night, where these poultry do what reside, because the poultry they roam during the day, but at night they have these shelters where these poultry stay. So it means the idea of shelters is think about how can we, if we are to do that, because I have listened in for some interesting findings whereby they said that those who had more poultry, the children had more cases of diarrhea. Okay. Those who had more than other poultry, they had more cases of diarrhea. So there is one of the points, or the interventions that should be thought of. How do we help those keeping this poultry to access or obtain feeding poultry feeds? That is one. But then two, we know the alternative use of the poultry droppings, because one of the reasons why someone would have an enclosure is to collect the poultry droppings and ensure that these droppings are not tattered or littered within the compound. And scientifically, we have various uses of poultry of poultry droppings. Besides using them as fertilizers, these droppings where there is litter, like maybe husks and what, they can be used as feed for animals like pigs. It is a matter of getting the droppings, dry them a bit, because it is good that the diseases that affect poultry do not affect pigs. So there is no risk of transfer of diseases from poultry to the pigs in that way. So I would think that maybe still, if people were to know the alternative uses droppings, to have this poultry confined somewhere, because at the end of it all, someone knows I have the droppings which I can use either as manure, or I can transform them this way to use them as feed for pigs, because they have some good source of proteins that is used for. I believe those are some of the points I wanted to raise, especially regarding to roaming poultry, and it is a practice that is still existing. Okay, and as you said, among the rural people, really they find it hard to shift to the intensive poultry rearing if the feeding source is not addressed. Okay, so I think those are some of the points I had for us to think about in promoting poultry and fencing and maybe avoiding.
Okay, thank you very much, Doctor, for raising those critical issues, and we have taken note of them. I don't know, Chris, if there are other questions in the chat that we can read for Doctor in case they are technical.
Sure. No, and I think we'll I mean, we have about 20 minutes left, so I think what will make sense, given our time, is to try and line up a few questions for people, and then and see what else comes in the chat. So I guess what I would say is there's one question here that's in the chat that I can kind of briefly speak to, but then I would ask that Scovia and Simon, if you maybe just take a second to think about sort of what you found sort of most challenging and what you think was most challenging in terms of being on the ground and trying to help people change their behaviors that we just talked about. So once I answer this question, I'll then turn it over to you two to provide your perceptions, okay? And then there's a question here that's more research related. So then I'll ask Angela and Aisha to just to be ready for a question there. So first, though, there's a question around how was this intervention selected? Was there any sort of community involvement? So that's a great question. So the answer is a lot of community involvement. So there were a number of focus group discussions, I believe 7, both by gender as well as combined in communities to inform this project. There was also partnership with a local agricultural training center of excellence that had expertise in poultry rearing in this rural setting. And so they joined for those discussions as well as the program design development. And frankly, I think that one thing that we found is that a lot of what people wanted was more livelihood advice. For example, like how do you use a brooder, very technical livelihood advice. And so we deferred to the community in that and integrated that. But then what we found in the results is that people didn't actually do any of those behaviors. So I think it was very participatory. And I think, yes, so it was very participatory, but I think there are some shortcomings in how we filtered those responses, because it ended up, I think, being very tailored towards people who are very, very interested in technical aspects, but maybe weren't actually going to do those technical aspects, if that makes sense. So then with that, I'll turn it over maybe first to Simon and then to Scovia. So if you could just take a minute or so and provide, what your main findings were, what you found sort of challenging, and what you think the community found challenging in terms of making these changes.
Okay, thanks, Chris, for the presentation and all the most challenging thing which we found in the field when we were during the implementation was about the attitude and the culture as part of it. The people around, like as an issue of beautifying their compounds, and also looking at the numbers, like mostly you could find some people had like 5 and 3. So for them to construct these houses, they could feel they are just taking time, but confining them could be like challenge, because they are looking at them being a few, and they could prefer maybe doing other ways of managing the chicken droppings. And then another biggest issue here, which we found, was about the feeding, as the doctor said, address it by advising them on how they can use the locally available feeds, make their own feeds in homes. Able to, I would say the biggest issue was the numbers which they had. They were looking at them being few, and they looked at them not being able to manage them. They would not see any, they were not having a clear link on the
So,
which we try to explain to them all this. For example, the project is going on and the other people, like in other villages, they are having them on free range. It was quite challenging. Yeah. So they would also prefer to have them free because other people in the same other areas, they are also having them.
great. Thanks, Simon. And I think our connection, the connection's not great there, but maybe just to highlight some of the points that you made in case people couldn't hear it, was the issue with the flock size and sort of having very few chickens, so being hard to justify the investment. The issue of getting people to address the feed question, where we would try and promote using, I mean, it's a very productive area when you can use local crops to create feed, and the challenge of getting people to actually do that were two of the points that Simon just made, if anyone had a difficulty hearing. So Scovia, do you have any reflections you want to share with us around what was sort of challenging with this behavior change?
Well, thank you, Chris, and all the panelists. I will not divert so much from my colleagues, especially Simon. In the implementation, the community members, the project, or like the project more in the livelihood mode. That's why, like, they kept on comparing the number of birds versus the cost of construction. Yes, that's another challenge. Like we've already been mentioned, the biggest challenge again was on the food, on the cost of feeding. You know, maybe more so related to the situation of the COVID, there was a challenge of food. So community members would really challenge you like, oh, Scovia, oh, so-and-so, there is challenge of food. Do you really think someone can prioritize birds to human beings? So that is it, but also compared to the output. So it is still, it was still a bigger impact, but also behavior change, like, of course, it cannot come instantly. While some people would adopt some practices like brooding hatches out many chicks, but again, the brooding would be a challenge. You know, like keeping them safe until they are old enough, at least to protect themselves. So someone would testify, yes, I'm so happy I hatched like 30 chicks, but after a month, you will testify most of them being eaten up by vermin. Yeah, that was also another challenge in the improvement of this project. And what causes the number of birds? People value old birds than young chicks. So it is still, and then the litter is still there. And then maybe another one, maybe which is also behavior, that looking forward maybe can be taken under consideration, was like, just like Simon has explained, someone would be like, oh, but yes, we are enclosing our birds, but our compounds are still littered with chicken feces from the neighbors. So that was also another challenge. Like it wasn't so easy to measure the real impact or whether the practice is physical or not, because when you find birds in the compound, you cannot really know that they are for this person who was trained or for the neighbor unless you asked. Yeah.
Great. Thanks. Thank you, Scovia. Thank you, Simon. Wonderful. And maybe Angela now and Aisha, you know, there's a couple questions here that are more sort of research related that I would direct to both of you, and you know, whoever would like to respond, it would be great. So one was around how we measured reductions in fecal contamination, and did you specifically measure child exposure to feces and fecal contamination? So that being one question, and then any differences in behavior change based on the size of the chicken flocks and or what the chickens were for, eating or breeding. And so maybe if you don't mind answering those questions, and I would say as well, just this is a good moment given the time we have left, just any reflections you have, like what has struck you as a learning, something we didn't know a year ago, but that is important and relevant for this kind of community of practice.
Yeah, great. Thanks, Chris. So I'm going to take the question, and here's where the pandemic did impact some of our study design. And so what we ended up doing was doing child handprint samples to look at indicator organisms, fecal indicator organism E. coli, on households in our treatment and control groups to look at fecal contamination and so these are our data that are hot off the press, that we just recently wrapped up data collection, and so we're working on analyzing those results. But I do think, when we are considering pathways of exposure from poultry feces, it is important for us to think about what are the environmental reservoirs, what is the transmission pathway that should be monitored to see the impact of improved management of fecal contamination. We were originally interested in measuring contamination found in soil, but I think these are complex dynamics and could be very context specific, and so there was another question of measuring child exposure, and one way on the actually go in and observe for extended periods of time how children are interacting with the environment, how the children and household members are interacting with poultry feces. With some measurements of fecal contamination, and there are even molecular targets that are specific to avian feces that could be used to distinguish fecal contamination that you're detecting in the environment between feces or sources of those indicators, and distinguish it that, oh, this is actually an avian specific fecal indicator that we were interested in using. But once again, because of the pandemic, we had to adjust some of our study design there. So I don't know, Aisha, if you want to add anything there or on any of the other points. You're on mute. There you go.
I think just real quick, I mean, we focused on kids who are in the crawling age range. So we sampled the hands of the kids that are between the ages of 6 months and 18 months old, if such a kid lived in the compound. Sort of assuming, based on what we know about kids, even though we have not observed these particular kids, we are assuming that, they have a sort of, interesting exposure profile of crawling around the compound. And I think in terms of learning from the project, I think we're all learning as we go along that this is really complex. I think this is sort of not, I think hopefully this has really come through from everything that's been presented, that it's just there's a lot of complexities here. And it's really important, I think, when we're designing the research to be mindful about collecting good measurements across the entire chain and maybe not really on a single indicator that is intervention along the causal chain, just to see if things break down. Where do they break down? How do we interpret these findings? How do we kind of just put everything together?
Yeah, thanks. And I think measurement, like we were very thoughtful about the measurement of the indicator organisms on child hands, and we did feel like that was a useful indicator to capture. The second question on behavior change based on the size of chicken flocks. So a lot of our data collection was either observation of physical infrastructure like an enclosure or hand washing stations. And then some of our behavior data were self-report, right? How much time in the previous day did you spend, managing your poultry? And so looking at some of our baseline data, we did see that flock size was often a predictor of many of these other types of, indicators related to poultry feces management. So, the size of the flock was a predictor for observed enclosure at the compound. Flock size was a predictor for the time spent managing poultry. Flock size was also an indicator for the presence or absence of free roaming poultry at the time of the survey. And so I do think flock size is, and it's also a predictor of the chicken feces observed in the compound at the time of survey. So we do see flock size really being a strong predictor for some of these poultry management related indicators and behaviors that we captured.
Great. Thanks, Angela. Thanks, Aisha. I just switched my audio, so hopefully it's better now. Just in time for the last 5 minutes. But no, thanks, everyone. I think you offered a lot of great perspectives, both on the research side as well as from the community side, and what it's like actually doing the behavior change efforts. And I think that, the kind of common themes are, it's like, this is like incredibly complex and very difficult. And it's not going to be a simple training exercise that addresses it. I think that's kind of what we know. And then there's a lot we don't know, and there's a lot more work that needs to be done here. I think that, this project, it contributes a lot of interesting insights, fills a huge gap in terms of our knowledge in lots of ways. And I think along with the research I mentioned in Bangladesh, kind of gives us some sense not generally seeing in many ways, and I think bringing us also give some really interesting perspective, and also really struggled to change behaviors to a sort of new, more profitable, more proactive poultry management level. Like, that was that goal, and it did not see that according to it in here. Are there any kind of final thoughts from any of our panelists in terms of what they've taken away from this project? I think we've covered it all. Again, I'll put the link again to the video in the chat, because I do think it's helpful to be able to see what this looks like on the ground. What's the condition like, and that makes it a little bit more real. So I would recommend that. I'm also going to put in the chat the next billion article that sort of summarizes what this project was and what sort of motivated it. So I think those are important documents. And I think, our kind of conclusion from this, if we were to kind of wrap it up, is to say, I would return, frankly, to what motivated this project for us to begin with. We did a household survey, and with research in NC State, we looked into what were the patterns of caregiver-reported diarrhea in households, and we found that households that had more than the average number of chickens, which was 5 for that particular survey, had an 83% higher risk of caregiver-reported diarrhea. And again, as an association, in one particular context, with all those caveats, I think it speaks to the importance of poultry for WASH. And so I think it's important that, when we have these results, that we don't retreat from it, because it's critically important for WASH based on what we're learning. And so it's important that we take additional steps. And it would be great for there to be additional collaboration with have dealt with poultry and are interested in poultry for other reasons as well. So with that, I'll just thank you, everyone, and turn it over again to Grace to close this out.
Okay, thank you very much, Chris. And from me, I just want to thank everybody, all the participants, and the panelists, and Chris, Simon, Scovia, Dr. Mugezi, and all the participants. I know this is just the beginning. We are going to continue with these interactions and sharing. I wish you the best we will be sharing the presentation with all the stakeholders that confirm the participation. So I wish you all the best. Thank you very much for taking part.